Oh my gosh, ingrown toenails. So ingrown toenails can be crazy. I've seen nails come into my office where the nail is not only ingrown into the side of the nail, but it's been going on for so long that it's digging out through the tip of the nail. So it's grown along the side, created that point has been digging in along the side and actually digs through the tip of the nail. And there's a hole at the end of the nail or at the end of the toe with the nail sticking through. And patients will tell me that, I've been dealing with this for 2 years. I have no idea how these patients have that kind of pain tolerance. If I've had ingrown toenails, both my big toes. So if a podiatrist gets them, anybody can get them because obviously we should if we know the secret to keep them from happening, we would do it. But I've had both my big toenails taken care of from a friend of mine who's a wonderful podiatrist. Um, and so it happens. I don't know how people could go 2 years though, or months. When I first started having the pain, I got in right away because it was just killing me. But at any rate, they do. People will wait. They're afraid of the shot. They're afraid of the pain. I can tell you it's really not that bad. Usually when patients come in super nervous or anxious, so of course that's an issue because it's his mindset. But if you come in thinking, yeah, it's just a little shot, not a big deal. It's usually not a big deal. It only takes a few minutes to do a nail procedure. But not every nail that's ingrown is infected. I have patients all the time that come in and they have an ingrown toenail. They've got swelling on the side of the nail. They've got pain. They've got redness, and they automatically think it's infected. Usually, from what I've seen in my experience, I've been practicing 20 some odd years, that the pain and the problem with the nail is not an infection, but irritation from the nail digging into the skin. And once you remove that irritant, then the pain resolves pretty quickly. The redness goes down, the swelling goes down. But the sooner you get to it, obviously, the better it's going to be. The longer you wait, like uh, if 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 it's accepted online, I'll post pictures of the nail going through the skin. It's absolutely crazy. Um, but if you got the pain, there's no reason not to get it taken care of. And if you're early enough in the pain process, it may not even need a nail procedure. You may just maybe file down the nail, maybe trim the nail, maybe all you need. And so you could avoid a shot altogether. But the longer you wait, then the bigger the chance of having a procedure. And of course, a bigger procedure. If that nail is digging through the end of your toe, then that's going to be a bigger procedure than if you just have a little piece that's kind of poking that you can file down. But not always an infection. So you don't always need oral antibiotics. I will say that if you have an ingrown toenail, maybe you have an ingrown toenail Wednesday or Thursday, and you're just kind of guessing, you're saying, I don't know whether it is or not. I'm going to wait a little bit on it. And you get through the weekend. And then by Monday or Tuesday, you're like, oh my gosh, I got to go see somebody. Well, when you start having that pain on Wednesday or Thursday, a couple of things you can do. Do some Epsom salt soaks or warm water and white vinegar. So the ratio there would be get a basin, fill it with warm water and white vinegar. 1 cup of white vinegar to 2 cups of warm water is the ratio you fill it up. Both of those things, white vinegar and Epsom salts, will help to ease the pain, will help to relieve the inflammation, and may just do the trick, soften things up enough to where it doesn't bother you. Tylenol for pain. If ibuprofen does the trick for you, then that's totally fine. But remember that ibuprofen is an anti-inflammatory and it relieves pain by relieving inflammation, whereas Tylenol is just a strict pain reliever. So if you've just got pain, Tylenol usually is the way to go for that. But I have patients who swear by ibuprofen, Motrin, Aleve, and that's fine if that works for them. But remember, it's not candy. Just because it's colorful and it's over the counter does not mean it's unlimited. And if you have kidney problems, obviously you want to stay away from those unless you've talked with your doctor about taking nonsteroidal anti-inflammatories like ibuprofen or Motrin, Aleve, naproxen, those kind of things. But if you do the soaks, if you take the Tylenol, that may do the trick. You may not have to come in. But typically, if you've been dealing with this pain 5, 6, 7 days, it's time to get it fixed. It's time to come in. Maybe it is infected. Maybe you just need an antibiotic and that'll take care of it. Generally, though, with an ingrown toenail, if it's infected, that comes with the fact that the nail's digging in, causing that infection, and you need to get that piece of the nail out of there. Another thing patients tend to ask is, do I have to remove my whole toenail? And the answer typically is no. Not always. I mean, sometimes we have to remove the whole nail, but typically you can take just the side out that's bothering you. And there are ways to do that permanently to where it doesn't come back. Now, permanent is relative unless you actually go to the OR and have that root of the nail cut out. You will try to kill the root. The doctor will try to kill the root in another way in that corner. And about 95% of the time, that is pretty effective. But every now and then, the nail will come back. You just have to know that there is, a little bit of risk there of that recurrence, but it's really small. But yeah, if you've had pain for 5, 6, 7 days, it's time to come in. Please do not try to dig at that thing yourself. If you are digging into your toenail to try to trim it out, one, usually it's way deeper than you can get to, so good luck. Two, it's really painful. Three, you tend to introduce bacteria into the area that's going to create an infection. So for those reasons, 3 strikes, like the Shark Tank says, for those reasons, I'm out. Don't do it at home. Just make sure you get to the doctor and get it taken care of. Ingrown toenails are things that podiatrists, foot doctors deal with every day, multiple times a day. We're very experienced in taking care of those. So let us look at it, take care of it. Don't waste your effort on that at home, because typically you're just going to get into trouble.